Mental health care is an essential community service, but many people are unable to find the right treatment programs. Welcome back. I'm Russ McCaskey.
And I'm Nicole Gabe. Now, Florida is ranked 49th in the U.S. for access to care, and people in our community are really feeling the effects. Week News Investigates reporter Kelly Miller sat down with one mom who says the mental health care system failed her daughter.
Somebody just needs to be held accountable, and I'm not okay with this.
What started as an ordinary day for this mother and her daughter ended in a traumatizing trip to a mental health care facility nearly 100 miles away.
The communication was just very poor, especially being a parent who has never dealt with anything this severe before. It was scary.
Scary for mom and for her 15-year-old who suffers from anxiety and depression.
That's actually strange.
Mom asked us to hide their identities for medical privacy. Regardless, she wants answers.
And I don't plan to stop until somebody takes it serious.
On April 12th, the teen had a manic episode while in class and later that day at home. Mom says she called 911 when the daughter attempted to hurt herself.
911, what is your emergency?
Deputies from the Lee County Sheriff's Office responded, according to this police report. The teen was then sent to Golisano Children's Hospital under the Baker Act.
I never knew what that was.
The Baker Act is a Florida law which allows for the involuntary examination and temporary treatment of individuals experiencing a mental health crisis. A person can be held for up to 72 hours, and during that process, a doctor determines whether longer-term treatment is needed. The teen's medical records, which mom provided to me, show she was held at Golisano for about 5 hours. And late that night, sent to Suncoast Behavioral Health Center in Manatee County, where she'd spend the next week.
And from the minute she was taken there to the day I had to request discharge, it was nothing but problems. There was no communication, no one answered the telephone, no one gave their names. I have a notebook full of every interaction, every time I called, who I spoke to, everything, dates, nothing.
Mom gave me a copy of her notes, which date back to April 12th.
Every time I called, I asked to speak to the doctor, who was, I found out, the medical director there, Dr. Steven Stein. He never returned a phone call. The only time I got a phone call back was when he wanted to switch her Lexapro to Prozac and then up the milligrams in a day's time, and I was concerned by that.
April 15th, Mom's Verizon call log shows she called the facility 7 times to get an update on her daughter. Although she eventually got a call back, Mom says it wasn't from her daughter's doctor. Suncoast only allows visitors on weekends for 1 hour. Mom saw her distressed teen once before requesting discharge on April 19th. Do you feel like the mental health services that she received made the situation worse?
Yes, 100%. 100%. And if I could go back, I definitely would, because this was not the purpose of it.
I reached out to Suncoast Behavioral Health Center and Dr. Stein. A representative provided me with a statement. It says, in part, due to HIPAA patient privacy laws, we are unable to discuss specific patients or their care. Any allegations are taken seriously and thoroughly investigated. We are dedicated to providing quality services in a supportive, healing environment. After hearing this mother's story, I met up with Charlotte County Sheriff Bill Prumell. He serves on a commission tasked with evaluating mental health care and substance abuse services in Florida. Earlier this year, he presented a report to state leaders in Tallahassee. Listen in.
Ladies and gentlemen, our mental health and substance abuse system is outdated and it doesn't work.
The 2023 interim report includes a list of recommendations the commission believes will improve Florida's system of care. The first one, create a program to improve data transparency.
One of the frustrating things is that we don't share information anywhere in the state. They all have their own databases. So somebody can bounce from system to system and nobody's the wiser.
Another recommendation, implement a 3-year pilot in which one entity manages all public health funding.
The money follows the program. So if that money funds this program, you're golden. But then as you move into this program, if there's no money there, they need to try and find the next best thing for you that is funded.
I also talked to Pramel about number 9 in the report, modernize the Baker Act.
We have other avenues that we may be able to go with somebody rather than just taking them in and Baker acting them.
And as this mother believes, forcing a minor into a broken system is not always the right approach.
And she felt like it was more of a punishment than, a place that was supposed to help her. And that's not what it was at all. And I don't think any kid should feel that way.
The Commission on Mental Health and Substance Abuse is set to end in September. But Pramel says he's working closely with Florida senators to get an extension for at least 2 more years.
We have a chance to make it right and make a difference, and we need to. We need to, and I hope our legislators don't kick it down the road.
I'll stay on top of what happens next with the commission. Dr. Stein did not respond to my request for comment. Golisano Children's Hospital told me the goal is for these patients to get treatment in the least restrictive environment possible. As for the teen, mom says she's doing better, now enrolled in Florida's virtual school system. And mom, she filed a complaint against Suncoast through the Florida Agency for Healthcare Administration. To read the commission report or for information on how to file a claim, head to my story on winknews.com. Back